Welcome to your lecture on vaccination. A vaccine is a biological preparation that provides active acquired immunity. It's a substance used to stimulate immunity to a particular infectious disease or pathogen. It's typically prepared from an inactivated or weakened form of the causative agent or from its constituents or products. Vaccination is the process of stimulating that protective immune response in animals against pathogenic microorganisms by exposing them to a non-pathogenic form. Vaccines can either be infectious or non-infectious. The non-infectious type is also called killed or inactivated. These are vaccines that contain a killed or inactivated pathogen, such as a virus or bacteria, that cannot replicate or cause disease. These vaccines are used to protect against diseases such as hepatitis A, flu, polio, and rabies. The immunity provided by inactivated vaccines is generally not as long lasting as that obtained from live attenuated vaccines. Multiple doses over time are needed to obtain ongoing immunity. In general, the first dose will prime the protective immunity or the immune system, and a protective immune response develops after the second or third dose. Unlike live vaccines, which produce the immune response that closely resembles a natural infection, the immune response to an inactivated vaccine is mostly antibody production. Little or no cellular immunity results. Antibody titers against inactivated antigens diminish with time. As a result, some inactivated vaccines may require periodic supplemental doses or boosters to maintain the antibody titers. Inactivated vaccines include whole cell inactivated vaccines like polio or hepatitis and rabies, subunit vaccines like influenza and pneumococcal pneumonia. A subunit vaccine is a vaccine that contains purified parts of the pathogen that are antigenic or necessary to elicit the protective immune response. Toxoids are another type of non infectious vaccines. Example is diphtheria and tetanus. And recombinant vaccines are also a type of non infectious vaccines. And some examples would be the HPV or hepatitis B vaccines. These vaccines are made non viable, so again, they're incapable of causing disease. They are made by growing the virus or bacteria in a culture media, and then the virus will be inactivated with heat or chemicals like formalin. This process stops the virus from making more copies of itself. Then the vaccine is purified. So if the vaccine is protein or polysaccharide based, it undergoes further purification so that only the subunit of interest remains. The drawback to non infectious vaccines is that they may be inadequate and they may require the addition of something called an adjuvant. An adjuvant is a substance added to some vaccines to help the body create a stronger immune response to the disease the vaccine is intended to prevent. They are compounds that may enhance the magnitude, breadth, and longevity of the specific immune response to antigens, as well as direct the quality of the immune response, but they have minimal toxicity or lasting immune effects on their own. Evidence shows that the adjuvants employ one or more of the following mechanisms to increase the immune response. They sustain the release of the antigen at the site of injection. They upregulate cytokines and chemokines, and they also recruit other cells to the site of injection. An example of one that is commonly used is aluminum hydroxide or other aluminum salts. They do, however, the drawback of these is that they may be responsible for vaccine reactions. Our other main type of vaccines are the infectious or live vaccines. Live vaccines use a weakened or attenuated form of the germ that causes the disease. So the pathogen is altered so as not to cause disease, but still infects the host cells to stimulate immunity in a natural way. They're usually either modified live, attenuated, or recombinant types. So recombinant can either be live or inactivated. The advantage of these is that they stimulate the immune system more naturally, like an actual infection, but some of them may actually cause the disease. So you can see that the virus up here can be used to make modified live vaccines and other forms of inactivated virus vaccines like the subunit, the recombinant, and the DNA type vaccines. The modified live and the recombinant are both considered types of live vaccines, although they differ in how they're produced. The modified live vaccine uses a weakened form of the live virus, while the recombinant vaccines use a genetically engineered virus to express specific antigens, essentially creating a modified live virus with desired characteristics. So it's kind of like breeding the virus to get the part of it that we want. And DNA vaccines, we don't talk about much in vet med, but these are also known as genetic vaccines, and these vaccines are inactivated and injected IM, and they are made by killing the microbes, such as through a chemical or heat treatment. For example, hepatitis V vaccine is inactivated and made from the blood of donors infected with the virus. Modified live vaccines are derived from a naturally occurring pathogen that has been weakened through laboratory techniques, so it does not cause a disease but still triggers an immune response. This is the process of attenuation. This often provides strong and long-lasting immunity due to its similarity to a natural infection. These types of vaccines may not be suitable for immunocompromised patients. In a vaccine live, the virus is attenuated or weakened in a few ways. By repeated culturing, the virus is grown in a series of cell cultures or animal embryos, such as chick embryos, and with each passage, the virus becomes less able to replicate in the original host, but better able to replicate in the new host. Also, genetic engineering techniques and introducing it into different species is part of this process. These attenuated viruses are used to create live vaccines, which trigger an immune response in the body. The immune system responds similarly to a weakened vaccine virus as it does to a wild virus. The resulting infection is usually milder than the natural disease, or it may not cause disease at all. So these um, weakened viruses are able to replicate in the body, but we don't have the clinical symptoms of disease. These attenuated vaccines have been used to successfully prevent many infections like mumps, rubella, and polio and yellow fever. However, there are some drawbacks, as there may be secondary mutations. The attenuated virus can mutate back to a virulent form, which could cause disease in an immunocompromised patient. Also, since these vaccines need to be kept at a certain temperature to survive, they're more difficult to transport. And the recombinant vaccines. These are vaccines that are made in a laboratory using recombinant DNA technology to produce the vaccine antigen. DNA encoding for an antigen is inserted into a non-pathogenic carrier or vector virus. And when injected into the animal, the viral genes will be expressed and antibodies will be produced. These vaccines are created using genetic engineering to insert the gene for a specific antigen into a harmless virus or bacteria, allowing it to produce only that desired antigen. They're considered safer than some other live vaccines because they only present a specific part of the pathogen to the immune system, and they can be tailored to target specific aspects of a pathogen. Recombinant vaccines can be either live or inactivated depending on the type of vaccine. Live recombinant vaccines, like the one you see here for FELV or feline leukemia, is a vaccine made from a live weakened bacteria or viral strain that carries genes for the vaccine antigens. Vaccines are specifically made from bacteria. The bacteria can be killed, modified live, subunit, or toxoid. When you look to the right here, we have a Brucella abortus vaccine that is a live culture. The subunit vaccines, remember, only contain a portion of the bacteria, the portion that is needed to cause the immune response. And this can be a protein or a polysaccharide. And then toxoid vaccines are made using the inactivated toxins that are produced by bacteria. These toxins are inactivated the same way using heat or chemicals. Some bacteria actually cause disease by producing toxins. Tetanus is a perfect example of that. And the ability of the immune system to recognize and eliminate these toxins provides protection from the disease. Vaccines can be monovalent or polyvalent. The monovalent vaccines immunize against a single antigen or microbe. An example of a monovalent vaccine would be rabies. And then our polyvalent vaccines immunize against two or more microbes or strains of the same microbe. An example of a polyvalent vaccine would be our combination vaccines for the cat and dog, the FVRCP and the DHPP. So, just a couple things to remember. No vaccine provides 100% of protection to 100% of animals. Everyone is different depending on age, their health, and their genetics. No vaccine provides better immunity than recovery from natural disease. With natural infection, you get more of the pathogen, more antibodies, memory cells, and nothing is more efficient than our own immune system in response to an actual infection. Vaccines are cost effective and they are effective with many diseases in controlling diseases and reducing the morbidity and mortality of those diseases. One of the things that may interfere with vaccination is maternal antibodies or passive immunity. Newborns can make their own antibodies, but their immune systems are not fully developed and they rely on other sources of antibodies in the first few months of life. The maternal antibodies are delivered through the placenta, and the antibodies come from the mother to the fetus during pregnancy. After birth, the baby receives more antibodies through breast milk and colostrum. These antibodies protect the babies from pathogens until their immune system is ready. This type of immunity, again, is called passive immunity, and it's short lived, and the antibodies usually last only about 6 months. The maternal antibodies are passed down again through pregnancy and breastfeeding. However, they can negatively affect the effectiveness of certain vaccines in infants or baby animals by inhibiting their immune response to vaccine antigens. It's a phenomenon known as blunting. Essentially, the baby's immune system may not need to produce its own antibodies if it already has high levels of passively acquired maternal antibodies. So it keeps it from doing so. High levels of maternal antibodies can neutralize the vaccine virus or bacteria before the infant's immune system has a chance to develop its own response, effectively blocking the vaccine's ability. And some vaccines will be more affected from maternal antibodies than others. Some key points here are that, for example, with a kitten, they have lost most of their mother's protection, but they haven't yet developed their own immunity, and that's called the immunity gap. And you can see that on the chart here. So the gap usually occurs between 4 and 12 weeks of age, and this is why kittens start their first round of vaccines between 6 and 8, and we do the boosters, and this is after they've been weaned, and the vaccine should be repeated every 3 weeks until the kitten is 16 to 18 weeks old. The final vaccine, boosters, and rabies vaccines should be given between 14 and 16 weeks. Other factors that can affect vaccine efficacy are a compromised immune system, poor health, certain genetics, and also there's always going to be non-responders. So there's always an exception to the rule in life and in medicine, and sometimes it's just not going to work for a certain type of patient. Another reason why vaccines may fail may be due to the manufacturer, maybe the adjuvant that was added or the epitope are not effective. Other reasons may be for natural reasons, genetic mutations, something called an antigenic drift. And this is when there are gradual accumulation of mutations in the genetic makeup of the virus, and this changes the proteins on the surface of the virus that are the antigens. These changes make it harder for the body's immune system to recognize the virus. And then other reasons may be incorrect administration, like if the vaccine was given sub-Q when it's supposed to be IM, or improper storage if the vaccine wasn't refrigerated when it was supposed to be, or if it was expired, for example. These reasons, it's extremely important to follow direction from the manufacturer on the vaccine instructions for storage and for route of administration. So most vaccines are either given sub-Q, IM, or intranasally, and they are usually refrigerated. But make sure you read the package to know what needs to be done for each vaccine. We always want to check vaccine expiration dates. You want to make sure you use a sterile syringe and needle. We do not combine vaccines in one syringe. And always note the site of administration in the medical record. So, for example, right back leg if you're giving rabies, because if down the road or in the following days the patient has a vaccine reaction and they're sore in that leg, we know that it may be related to the vaccine that was just administered. Some vaccines are lyophilized vaccines, which means that they have a freeze-dried portion and a diluent is used to reconstitute the vaccine. Usually the diluent will be in a separate bottle, and then you'll have to draw up a specific amount, which is usually 1 ml, and we do this measuring the correct amount, and we insert the diluent portion into the freeze-dried portion to reconstitute the vaccine. These lyophilized vaccines may have longer shelf life, and they are not as stable. So we want to make sure we're only drawing these up when we're about to use them, because they should be used within an hour of being reconstituted. Remember, vaccines are a medical procedure and they do carry risk, and there are some common side effects that can resolve within a couple days. And these are considered a normal immune response or an inflammation response, and that includes discomfort and local swelling at the vaccination site, possibly a mild fever, and even decreased appetite and activity. Serious vaccine reactions may occur, and these are not considered normal. And this would be something like persistent vomiting or diarrhea, itchy skin, hives, swelling of the face, like you see in this boxer on the right, or neck or eyes, difficulty breathing, collapse, and even anaphylactic shock. If the patient is experiencing some of these, we most likely would treat something like swelling or itching with an antihistamine, maybe even a steroid. And if they're having an even more serious reaction like anaphylactic shock, they may be treated with epinephrine and IV fluids. Cats especially can experience something called feline injection site sarcomas, which is usually abbreviated FISS or FIS. These are fibrosarcomas that occur due to vaccination. Most of them are benign, but we do biopsy these if they follow what is called the 3-2-1 rule, which is a guideline for veterinarians and cat owners to monitor these sites. 3, the lump is still present 3 months after the vaccination. 2, the lump is larger than 2 centimeters in diameter. And 1, the lump continues to increase in size 1 month after the vaccination. So that's your 3-2-1 rule. If the lump follows those rules, we're going to biopsy it to find out if it's cancerous. And if it follows these criteria, you're going to put an incision, biopsy it, and rule out the FISS. Now, this is another reason why we mark in the chart where the vaccine was given, because then we could find out what vaccine caused this. 1, we don't want to give it to the cat again, and 2, it should be reported to the company that this caused this. And sometimes you may even warrant a CT scan or an MRI to evaluate the extent of the disease. For some reason, cats are prone to developing these, so all lumps should be closely monitored on cats. Not a lot of research shows why this happens to cats, but it does specifically happen in cats. So if you look to the right, the AAHA has given us the recommended sites for vaccination, and they are on the legs and the tip of the tail. And the reason for this is if the cancer develops and a limb needs to be amputated, it is easier to get rid of the cancer that way. So you can see there's X's over the cat's shoulder and neck and thigh. We don't want to give it there. We want to give it somewhere that in the event that a limb needs to be amputated, it could be done so to save the patient. Administering a vaccine to a patient, there's some things to consider beforehand, weighing out the risk versus benefit. Is the disease fatal? So for example, rabies, right? So this is why rabies is a core vaccine. is the disease transmittable to humans? And this is something that's very important in food animal industry, right? Because if it is, then it's probably going to be a core vaccine for cows, for example. Is it legally required, like rabies? What is the exposure risk? So depending on where you live, is your dog going to be more susceptible to lepto and Lyme, depending on the region? And is there any potential risk in giving the vaccine? So we have to also look at the health of the patient, the age, to find out what is the risk versus benefit. So this is why we have the distinction between core versus non-core vaccines. So, and again, these are going to vary from species to species for cats, for dogs, but core vaccines are the ones that are recommended for animals of that species. Like, for example, for dogs, rabies, distemper, parvo. And then non-core vaccines, depending on the lifestyle of the animal. So is your dog splashing around in puddles all the time? Are you going through the woods? Then you're probably going to need that lepto vaccine and Lyme. Is the dog being boarded? Then we're going to talk about Bordetella. Our core vaccines for felines include rabies, feline viral rhinotracheitis or feline herpes virus 1, calicivirus, feline panleukopenia, and FELV for cats that are under 1 year of age. The FVRCP combo will have the herpes virus, calicivirus, and panleukopenia all in combination. Non-core vaccines for felines include FELV or feline leukemia virus, chlamydia felis, which is a bacteria that causes upper respiratory infections in cats, Bordetella bronchoseptica, which is the bacteria responsible for kennel cough in cats, feline coronavirus, which can lead to FIP, and Giardia lamblia, which is a protozoal infection. For canines, our core vaccines again include rabies, which is mandated by the state. And then we have our combination vaccine, which is the canine distemper virus, canine adenovirus type 2. And if you are vaccinated with type 2, that protects you against type 1. And type 1 is the one that causes hepatitis. And then we have canine parvovirus and canine parainfluenza virus. Just recently, leptospirosis has also become a core vaccine for canines. This is a zoonotic bacterial infection. So you can have the DHPP, which has the first 4, and then the DHLPP combination has all 5. And then the rabies is given separately. Some non-core vaccines for dogs include the Bordetella bronchoseptica, which is a bacteria again responsible for kennel cough, Borrelia burgdorferi, which causes Lyme's disease in dogs, and also canine influenza and canine coronavirus. So just a review for puppies and kittens, initial vaccine should start between 6 and 8 weeks of age when the maternal antibodies are still present but maybe dying off and we are not able to make our own antibodies. And then to fill that immunity gap, we booster the vaccines every 3 to 4 weeks until the animal is about 15 to 16 weeks of age when they should be able to make their own antibodies. There should be at least 2 weeks between boosters, but a maximum of 4 weeks. 3 weeks is a good number. And then, for example, in Pennsylvania, the rabies vaccine is given at 12 weeks of age, and we require a booster at 1 year of age, and then again every 1 to 3 years. So remember, an antibody titer is a blood test that measures the amount of antibodies in your blood, and a protective titer is the term used to describe a sufficient amount of antibodies that will protect you against that specific disease or pathogen. And here we're looking at an example of how booster vaccines work. And remember, live vaccines do not require boosters usually because they provide that long-term response. The amount of titer that's needed to be protective can vary, and there's inconsistency as to the actual amount that leads to protection when it comes to vaccines. Antibody production can take up to 2 weeks with that secondary response to be ready. Remember, vaccines mimic infections. They mediate the primary immune response that leads to the secondary immune response. So you have your exposure, you have your IgM, and then you're stimulated to make those antibodies so that when the secondary exposure or booster shot comes around, we have enough antibodies to fight off the pathogen. So when the body is confronted with the real agent, you can fight it off. With the original dose, the immune system is primed to recognize and produce antibodies against the virus that it's created to defend, and then the booster shots are administered to remind the body's immune system about the virus it needs to defend against, making sure that we're producing enough antibodies. Once primed, the secondary immune response is more rapid and robust. Thus, the goal of vaccination is to enhance the number of antigen-specific B and T cells against a given pathogen, right? We want those memory cells to provide sufficient protection against them in secondary exposure. Site of administration is important for vaccine reactions, and it's especially important in cats, considering the sarcomas that they may develop. So we do have protocol for where vaccines are supposed to go. The rabies vaccine always goes in the right hind leg. And this should also be noted in the chart as well. And that's going to be at the level of or distal to the stifle. So basically the knee, just below the knee. And then our left hind leg is where we're going to put feline leukemia vaccine and also canine Lyme. And if you look, they both start with L for left hind leg. Same thing at or just below the knee. And remember, that's in case we have a severe reaction where cancer develops due to vaccine reaction in cats and we have to amputate a limb. And remember, we can also use the far end of the tail. And then also in the right front leg is where we usually give our combination vaccines, the feline FVRCP and the canine DAP combos. There's just an image showing where that is. So you can see on the right front, they're giving a combination, and that's going to be just below the elbow. And then the rabies is the right hind, just below the knee. And then on the left side, on the left hind limb, we're going to be giving feline leukemia. And then on the bottom, you can see someone injecting the left hind leg, so that's probably a feline leukemia vaccine. And on the right, we have someone using a tail for vaccination as well. And let's review some horse vaccinations. So for core vaccinations, we have tetanus, which is caused by Clostridium tetani. And remember that that bacteria secretes or produces a toxin that enters the blood that causes those lockjaw and seizure symptoms. So this vaccine is a toxoid vaccine. And then we have equine encephalomyelitis, and there are three forms: the Eastern, the Western, and the Venezuelan. And then we have the West Nile virus and the rabies virus. And these are our core vaccines. Herpes virus, influenza, and strangles are non-core vaccine. Remember, strangles is an upper respiratory infection in horses caused by Streptococcus equi. We have equine viral arteritis, or EVA, Potomac horse fever, which is caused by the bacteria Neorickettsia rusticii, botulism, which is caused by Clostridium botulinum, and anthrax, which is caused by Bacillus anthracis. Also leptospirosis, which is a zoonotic bacterial infection, rotavirus, and the snakebite vaccine. The snakebite vaccine will protect horses from the venom of the western diamondback rattlesnake and other species like the western rattlesnake, the sidewinder. It doesn't protect against certain kinds of snakes, like the water moccasin, for example. But what it does is it works by stimulating the horse's immune system to defend against the venom. So this is also a toxoid type vaccine. For cows, the core vaccines are considered infectious bovine rhinotracheitis, which is a virus, bovine viral diarrhea, another virus, parainfluenza virus, and bovine respiratory syncytial virus. These are the 4 core for cows or cattle. Some other common vaccines that are also given and considered recommended are bovine herpes virus, leptospirosis, brucellosis, all the Clostridium diseases, and that includes tetanus. You can see one of these on the right. It's protecting against a few different species of Clostridium, and this would be considered a bacterin and a toxoid type vaccine. Also, bovine coronavirus, rotavirus, and Mycoplasma bovis are some other common recommended cow vaccines. So for goats and sheep, there is one very important vaccine, which is the Clostridium perfringens type C and D and Clostridium tetani combination. And this protects against enterotoxemia and tetanus. Goats and sheep may also receive rabies. They also may be mandated to receive rabies depending on where they live. And some other common vaccines for goats and sheep include the sore mouth or ORF virus. It's a pox type virus. Campylobacter, fetus jejuni, which is a bacterin type vaccine. Chlamydia pistachii for Hughes, and Clostridial 8 waves, which protect against many different species of Clostridium, and Caseus lymphadenitis vaccine. Vaccine guidelines are determined by the organizations that you see here. The big one for cats and dogs is the American Animal Hospital Association, or AAHA, and this organization is the one that decides what vaccines are core for canine and feline. And for example, this year they just added leptospirosis as a core vaccine for dogs. And the other organizations determine the core and non-core for bovine, equines, etc. And of course, any hospital that is AAHA certified should be following the guidelines set by them. So this can change year to year. So, it's something to always keep up to date on, and that's why we have continuing education. But that concludes our lecture on vaccines. Please let me know if you have any questions.